Hello friends, today we will talk about AIIMS question set number 7. The first question, which of the following is not an autoimmune disorder? The answer of this question is ulcerative colitis, because rest all three are autoimmune. Let's start with grave disease. Grave disease, it is the autoimmune disorder of the thyroid gland, where we have HLA-B8 and we have a HLA-DR3. Classically in this patient, we have TSH receptor antibodies, these patients also have thyroid peroxidase antibodies, and they also have a anti-thyroglobulin antibody. Point to be noted, these TPO and anti-thyroglobulin antibodies are also present in Hashimoto disease also. Okay. As far as rheumatoid arthritis is concerned, we all know they have a rheumatoid factor, but they also have anti-CCP antibodies, which are the most sensitive and most specific test to diagnose RA. In SLE, we have a ANA antibodies, which is the most sensitive test, but most specific test is anti-double stranded DNA antibodies. Then of course in drug induced SLE we have anti-histone antibodies. Other antibodies present in SLE are anti-SMN antibody. Okay, so the best answer to this question is ulcerative colitis, which is a inflammatory bowel disease. Okay, and the other disease which is again considered as IBD is Crohn's. Question number 2. Which of the following does not act by increasing insulin secretion? The answer is pioglitazone. Now, how does pioglitazone act? It acts by acting on the PPAR gamma receptors, which causes increased and thereby the action is it causes increased peripheral utilization of the glucose. As far as exenatide is concerned, it is a GIP GLP-1 agonist, and these two molecules, they go to pancreas and they cause secretion of increased secretion of insulin. Okay. Now, as far as sitagliptin is concerned, it is a DPP-4 inhibitor. It inhibits the breakdown of GIP GLP-1, so indirectly they also cause increased release of insulin. Ripaglinide, they belong to category of metaglinide. They are also insulin, I for insulin secretagogue. Before I discuss further about this drug, let us learn what do you mean by insulin secretagogue. The two group of drugs, one is metaglinide, to which ripaglinide belong, and other is sulfonylurea. These two drugs, this is the pancreas, here is the beta cell which contain insulin. Now these drugs, they come to beta cell and they cause release of preformed insulin. That's why they are known as insulin secretagogue. That means they have direct action on beta cell, which cause increased release of insulin. Okay. So out of all the options, the best answer to this question is pioglitazone. Now a few words about side effect of pioglitazone. Pioglitazone, they tend to retain sodium in water. That's why they can lead to hypertension, congestive heart failure. That's why they are contraindicated in patient of cardiac patient. And one more question, rather the question side effect which came as a question last AIIMS exam, is they can prone to bladder cancer also. Okay. Question number 3. Hyperdynamic circulation is seen in all except. The answer of this question is cor pulmonale, because in condition like anemia, beriberi, AV fistula, and in addition to this, also in hyperthyroid, also in Paget disease. In all these cases, we have hyperdynamic circulation. And one more thing, if the question is asked to you where we have all these conditions where we have hyperdynamic circulation, most of them are also cause of high output failure. And in most of these, they have a systolic hypertension. So if the question is come to you for hyperdynamic circulation, high output failure, systolic hypertension, or collapsing pulse, the answer is almost same. From here only you choices. Now, what is cor pulmonale? It is right heart enlargement. With or without failure. Secondary to lung parenchyma, pleura, or chest wall disease. Okay, and the common murmur that we heard in cor pulmonale is tricuspid regurgitation. In fact, the commonest cause of TR is cor pulmonale. And extra point about TR also, you get prominent V wave in this patient and you get pulsatile lever. This is a very frequently asked question about tricuspid regurgitation. Question number 4. Which of the following do not usually cause reduction in diffusion lung capacity of carbon monoxide? The answer of this is asthma. Now, diffusion lung capacity for carbon monoxide, it is reduced in all restrictive airway disease. Okay. But it is normal in obstructive airway disease. The only exception is emphysema. Emphysema is an obstructive airway disease, but the diffusion capacity for CO is reduced. Okay, and now I told you all restrictive airway disease diffusion is reduced. Now, what are the example of restrictive airway disease? Example are ARDS, interstitial lung disease, pulmonary edema, pneumonias. Now, if word about how will you differentiate between obstructive and restrictive airway disease. Okay, in obstructive airway disease, restrictive airway disease, FEV1 is highly reduced. It is reduced in restrictive airway disease. FVC reduce, highly reduced. Ratio of FEV1 to FVC highly reduced, normal or increase. It means if we have to differentiate between obstructive and restrictive, we go by ratio. Okay, but if you want to see the severity of an individual airway disease, you go by FEV1. Now, the other example of obstructive airway disease other than emphysema is chronic bronchitis, bronchiectasis, cystic fibrosis. These are the other example of obstructive airway disease. Now, question number 5. Hypertensive hemorrhage is most commonly seen in. The answer is basal ganglia. In fact, the most common site is putamen, which is a part of basal ganglia. Now, let us see what are the sites of hypertensive bleeding. Other than basal ganglia, second is thalamus. Then is the brain parenchyma. Then is the pons and cerebellum. Okay. When the bleeding occurs in the basal ganglia, the patient usually manifests as hemiplegia. But as per anatomy, you cannot explain hemiplegia based on basal ganglia. Now what happened? This is the internal capsule and here is the basal ganglia. Actually bleeding occurs in basal ganglia and the blood goes into internal capsule. There are fibers of corticospinal tract. This is how patient manifests with hemiplegia. Okay. Now regarding pontine hemorrhage, patient has got pinpoint pupils. Patient has got a high grade of fever, so called pyrexia, and patient has quadriplegia. So there are 3 P's: pinpoint pupils, pyrexia, and quadriplegia. And overall mortality is 100% in pontine hemorrhage because all the vitals area are lying in the pons. As far as cerebellar bleeding is concerned, these patients, because if the bleeding occurs cerebellum and it's a bleed where we can treat surgically because it is in the posterior fossa, we can have a cut in the posterior part of skull, we can drain out the blood. Okay, and if treated early, it has the best prognosis. But if you do not treat early, first one to die is among all the types of bleeding due to hypertension. First one to die is cerebellar bleed. Because of high pressure in the posterior fossa, cerebral tonsure will cone down and patient will die immediately. Okay, so best prognosis is again cerebellar, and the first to die if not treated is cerebellar bleed. Question number 6, which is not a part of SIRS. SIRS is systemic inflammatory response syndrome. The parameters include are, first is the pulse, tachycardia. Second is respiratory rate. Third is fever or even hypothermia also is also a part. And systolic BP below 90. In fact, this question what came is we got a memory based question. Now the answer of these are both of these. Okay, why? The SIRS include pulse, I told you, tachycardia, temperature, respiratory rate, and TLC count. TLC count more than 12,000 or less than 4,000. Neither urine output is a part of this, nor is systolic BP out of below 90. Systolic BP if below 90 is a part of septic shock. So the two answer this question, although I have written only one, but remember even systolic BP is also a not of SIRS. Now question number 7, investigation of choice for diagnosis of bronchiectasis. Answer is HRCT. Now first of all something about bronchiectasis. Typically in bronchiectasis patient has copious amount of sputum, maximum in the morning, in a particular posture. Patient may have hemoptysis. Sometimes patient only has hemoptysis, no sputum, then we call as bronchiectasis sicca. Bronchiectasis sicca. Okay, it may be a part of Carter-Jenner syndrome. In Carter-Jenner syndrome, we have a bronchiectasis, sinusitis, and situs invertus. In chest X-ray, you get Tom track appearance, or we may get ring shadow. Okay, but the investigation choice is HRCT. Now what are the other lungs condition where we use HRCT? HRCT we also use to diagnose emphysema, interstitial lung disease. Okay. Now in case of bronchiectasis, classically we use rotation of antibiotic. This question came recently in PGI Chandigarh also. The question was rotation of antibiotic done in which condition? The answer is bronchiectasis. Okay. Thank you very much for watching these questions. Well, I have some more information for you. I have recorded many lectures which you can see in our YouTube channel given in front of you. Plus, I am also sending a lot of last minute revision point to all the students. If you also want to get, then you have to send your name, you are in which college year, college city, email ID, and you can send. This is my personal WhatsApp number. You send me, I'll be sending you a lot of updates and last minute revision point. And one more thing, in the last NEET exam, 143 question came out of 300 from our last minute revision point given in all the books. Okay. And after I finish the AIIMS series, I will be also doing a series for PGI exam also and also for JIPMER. So stay tuned to my lecture series, Thank you very much again for watching this video.